Good afternoon, everyone. We got a good one today. The legendary Deepak Chopra is going to be joining us. Super pumped to talk to him. Renata Patel, we got a lot of people joining in here. Like we said, it should be a good one. Just waiting for Pak to join here. There we go. Hey,
Hello.
Deepak, how you doing?
Hi, Ricardo. How are you? Very happy to be with you.
Oh, fantastic. Listen, it's truly an honor to have you on here. I'm going to do a brief introduction just while everyone's logging on. Um, we are talking to the man who needs no introduction, but I'll go ahead and do it anyway. Dr. Deepak Chopra, who's a good friend and colleague. For those of you who may not know, Dr. Chopra is a world-renowned integrative medicine expert and New Age movement advocate, founder of the Chopra Foundation and the Chopra Global, as well as professor of family medicine and public health at UCSD, and senior scientist at the Gallup organization. He is the author of over 90 books translated into over 43 languages, including numerous New York Times bestsellers. For the last 30 years, Chopra has been at the forefront of the meditation and personal transformation revolution. As background, Time magazine has described him as one of the top 100 heroes and icons of the century. Larry King has described his work as some of the most important of the decade. The Wall Street Journal has declared his books as must-reads for your career. His books have been awarded numerous prestigious awards, including the Nautilus Award and the Quill Award. And two of his books have been recognized on the Books of the Century bestseller list. He is a columnist for the San Francisco Chronicle and contributes regularly to Oprah.com, Intent.com, and the Huffington Post. He has been recognized as one of the 100 most influential people in health and fitness, as well as number 17 most influential thinker in the world, and number 1 in medicine. Truly amazing. As background, he is board certified in internal medicine, endocrinology, and metabolism. He's a fellow of the American College of Physicians and a member of the American Association of Clinical Endocrinologists. Here today to discuss the ever-increasing collaboration and the overlap between Eastern and Western medicine, talking more specifically about the role of integrative medicine in academic healthcare. So again, Deepak, thank you so much for joining us. It's truly a pleasure.
Thank you, Ricardo. It's my privilege to be with you. Thank you for having me on your podcast on this live Instagram.
Wonderful. So we'll start just by going over the definition of what integrative medicine is according to the academic consortium, and you can say whether or not you agree with this. But what they say is that integrative medicine is medicine that reaffirms the importance of the relationship between practitioner and patient, focuses on the whole person, is informed by medicine, evidence, and uses all appropriate therapeutic and lifestyle approaches to achieve optimal health and living. Is there anything missing in this? Do you feel like this is an appropriate definition?
No, I think it's very appropriate. And in the future, where we go is, if it works, it's medicine, and we don't have to, classify as integrative, holistic, new age, or alternative. Anything that works is medicine.
What now? What about longevity? We're going to go over different topics of integrative medicine and how it should be incorporated into the academic community. Right? Longevity
Yes.
has become a very hot topic. Everyone says that anti-aging treatments not only to live longer but to feel better. In your opinion, how should physicians be incorporating integrative medicine into the longevity revolution?
Well, right now, the revolution called longevity is driven by the fact that the fastest growing segment of the American population is actually close to 100, the fastest growing. Now, society at this moment considers this a problem because as people get beyond 80, high incidence of chronic illness, Alzheimer's, dementia, a lot of cost in last terminal stages of life. The cost is overwhelming. It's in fact the medical cost of people in hospice and terminal illness is so overwhelming that it occupies most of the cost in a person's lifespan. So today people are talking about health span versus lifespan. Health span is how long can you live and be healthy at the same time. The evidence is showing that aging does not have to be accompanied by chronic illness. Only less than 5% of disease-related gene mutations are fully penetrant, which means they guarantee the disease. That includes Alzheimer's, that includes things like breast cancer, includes every single disease you can. If somebody has a BRCA gene, that's fully penetrant for breast cancer. But the remaining 95% are determined by lifestyle factors that restore homeostasis, like sleep, stress management, mind-body coordination, managing your biological rhythms, decreasing inflammation, emotional and social resilience, and ultimately self-awareness and the choices we make every day. So therefore, this has to be embraced for many reasons. In societies where people respect the elderly, in societies where people think that you can get to be biologically young and chronologically wise, you can have the combination of the wisdom of experience and the biology of youth. And that evidence is there. So I think right now, doctors definitely need to take an interest in longevity. At the University of Central Florida, close to where you are, in Orlando, we are launching a longevity experiment right now for those who aspire to live to more than 100. And we're including everything from biotechnology to neurotechnology to stem cells to anti-inflammatory measures to lifestyle. And we'll have 3 tiers for this. One, everybody will get a longevity exercise 5 days a week with a weekend to practice and rest. And then we'll have other tiers where they will be able to participate in a webinar. And then we'll be doing scientific measurements, including things like telomerase, telomeres, inflammatory markers, gene expression. So I'm very excited about longevity, and maybe we can collaborate on that as well.
Absolutely. I mean, you had mentioned that previously about that new experiment going on. We would love to collaborate. It obviously sounds
anyone
like it
who's
has a huge
interested
potential.
can send an email to longevity@choprafoundation.org.
Wow, wonderful, wonderful potential there. You had mentioned stress. I just want to talk a little bit about that because everyone knows stress can wreck the body. How can physicians currently assess the stress that a person's going through, and how should stress be treated?
So stress is usually defined as a perception of physical, emotional, psychological, even spiritual threat. It's a perception, and it's an interpretation of what's happening to you at the moment. And what it does is it causes something called sympathetic overdrive. So the sympathetic nervous system takes over, and our meta-analysis through our foundation shows that actually stress is the #1 pandemic of our time, and it's contributing to all the other pandemics, because once you have stress and you have sympathetic overload, and you also have inflammation and depression, and then it becomes almost a vicious cycle. It leads to more stress, leads to more stress, leads to more stress. The antidote to that is vagal stimulation. And when vagus is stimulated either through mechanical means or through technology or through breathing techniques or through meditation or through mind-body coordination or through Tai Chi or Qigong or yoga, then you override sympathetic overdrive. So this is very important right now. And I think physicians should be tuned into this whole area of stress management so that people can actually see that it's something we need to tackle. It's #1 pandemic. Suicide is the second most common cause of death in teenagers. Every 40 seconds, somebody in the world is committing or dying from suicide. And this is something, as physicians and healthcare workers, we all need to be very aware of. As you know, physicians themselves suffer from burnout, which means they get to a stage where they feel they don't have the capacity to fulfill all their obligations. So more on this in the future, but again, check out something called neveralone.love, www.neveralone.love. And we have a program there for stress management, also for helping people with depression, using an emotional AI named Peewee, who was the sister of our co-founder at Never Alone, actor Gabriella Wright.
Now, I'm sure everyone listening kind of wants to know, how do you deal with stress? Obviously, you have a tremendously busy lifestyle, a lot of commitments, a lot of responsibilities, so many things going on. You must have a tremendous amount of stress. How do you personally deal with it?
I don't have time for stress. I'm busy. I schedule my time. And when I'm doing what I'm doing, I'm totally focused. So, right now, the only thing on my mind is this conversation with you. And when that's the case, there's no stress. Stress is an imagination. You're either worried about the future or you're regretting the past. So when you're totally present to what you're doing, then stress doesn't arise.
Let's talk a little bit about meditation, because that's kind of been a centerpiece to your preachings. Should everyone meditate? And if so, for how long? Is there a certain amount, or is everyone's different?
Well, the old research shows that the ideal time for meditation is about 20 minutes twice a day. A lot of people say, I don't have time to do 20 minutes twice a day. Well, they should be doing it 3 times a day, because to say that you don't have time is already evidence of stress. When people say, I don't have time, my 20 deadlines, then that internal dialogue speeds up their biological clock. And one day they suddenly drop dead of a heart attack, and then they've run out of time. So never use the phrase, I don't have time, or deadlines. It's a very kind of intimidating phrase, deadline. You're supposed to be dead, or if you don't meet the line. So I would say, if you're present to what you're doing and not imagining the future or the past, which never holds out to be true, because every regret about the past is a story only we believe in, nobody else believes in. And everything that happens, we are worried about the future, almost certainly never happens as we imagine it. So these are called magical lies. And I would say, don't bother with magical lies. Go to the source of all experience, which is your own consciousness.
Oh, God, that's well said. Something else that's really come to the forefront in medicine are toxins, such as mercury, which can be elevated in many people and really rarely checked. Should physicians be routinely checking for toxins in their patients? And if it's elevated, how do we naturally detox?
I think the first baseline should be to measure inflammation, which, we have biological markers, cytokines, etc. And if there is inflammation, then the second step should be looking for toxins like mercury, etc. So toxicity comes in many forms. There's emotional toxicity, such as resentment, hostility, guilt, shame, mistrust, humiliation. There are toxic relationships, there are toxic jobs, there are toxic environments. If you look at the range of toxicity, it's huge. So you can't chase toxicity by itself but once you know that the patient has stress and toxicity, then you can measure it, and you can measure it in the form of inflammation, and you can look for the right appropriate things. There are many ways to detox. So emotional detox occurs through meditation and vagal stimulation and all the other things that, the vagus nerve is a very interesting nerve, 10th cranial nerve, but influences everything from facial expression to tone of voice to heart rate variability, and even the microbiome. And we now know that microbiome has two-way traffic, and 80% of your serotonin comes from your gut. So if you pay attention to things like deep rest, stress management, vagal stimulation, breathing techniques, balancing biological rhythms and circadian rhythms, then that would lead to what we call self-regulation or homeostasis. So everything that we call illness, other than the fully penetrant genes, is a disruption of homeostasis. And all the techniques that we talk about are basically only one intention: restore homeostasis. When you and I went to medical school, those were the first two lessons: homeostasis, inflammation, both protective. But if inflammation goes out of whack, then of course we suffer. But they're both protective mechanisms, and the goal of all medicine should be, how do we bring about biological healing through restoration of homeostasis?
Now, you talked briefly about inflammation, which I really want to go back to and focus on, because a lot of research has shown inflammation is correlated with heart disease, it's correlated with cancer, so many negative outcomes. How should physicians assess for inflammation? You had said measuring it, assessing it. How can physicians assess inflammation? And then how do you reduce inflammation?
Well, inflammation can be measured through measuring cytokines, which are basically protective also. They're anybody who's right now getting vaccinated or has been exposed to COVID-19, if you measure inflammatory markers, they're appropriately raised. That's what gives us immunity. But our meta-analysis shows that low-grade inflammation, low-grade depression, and low-grade anxiety precede chronic illness by many years. And sometimes the low-grade inflammation it doesn't have any symptoms except what people call free-floating anxiety, and they think it's normal. But at some point, we all have what is called existential anxiety: old age, infirmity, death, etc. So I think everybody should be screened for low-grade inflammation or inflammation. When you have an inflammatory storm, it's very obvious. If it's physical, you feel easily bruised. If it's systemic, you get easy infections, and all the young people that are getting COVID storms are actually succumbing to disease as well. So inflammation is very important. It can be tackled through Mediterranean diet, a diet that is maximum diversity of plant-based foods, that is not manufactured, refined, processed, or has great amounts of sugar. And then, of course, I go back to deep breathing, and there's something called the polyvagal theory. So everybody who's listening to this conversation, check out the polyvagal theory, and you learn a lot about it, and you learn a lot of ways to tackle inflammation, which is more than diet, breathing, mind-body coordination, and the things I've mentioned.
Now, you mentioned diet, and I just want to go back to that because it's so important, right? Diet is the fuel for the body. But out there's so much fake news, so many fad diets, hard to know what to believe and what is the best diet. In your opinion, what type of diet should physicians be advocating for their patients? And does diet change over time, over age, when you're 20 versus 50 versus 80?
Well, the amount of food that you should eat decreases as we age. On diet, there are three principles that I can say that everybody agrees that are not fads. One is a Mediterranean diet, which is very high in prebiotics. You can take all the probiotics in the world, but the probiotics give you a few billion, a few trillion bacteria that are healthy. That doesn't do much. Prebiotics are high fiber foods that are present in the Mediterranean diet, that are also present in an Ayurvedic diet. And one rule that should always be there is food that is not manufactured, refined, processed, or comes from a factory. So right now, if you eat meat and the meat comes from a factory, it will contain antibiotics, inflammatory products, hormones, and all kinds of junk. It's basically putting Agent Orange into your body and hoping that it'll help you. So don't, if you eat meat, get it from organic sources and, any kind of protein. And now there are new proteins that are being created, like Beyond Meat and many others, where people just rearrange the nucleotides in DNA molecule, and you can get about any kind of protein and the right flavor just from plants. So this is going to be a very huge revolution anyway, but short, follow a Mediterranean diet or an Ayurvedic diet with maximum diversity of plant-based foods. And if you eat meat, don't buy it from a factory, farm to table.
That is great to hear. And those principles really are just true over time. So whether you're 20 or 50 or 80, it's the same principles, which is good to hear, because out there's so much fake news, so many fad diets, very hard to know what to believe. Let's move on to sleep, which is absolutely vital. Just like inflammation, poor sleep has been shown to lead to heart disease, all types of emotional and physical conditions. What defines quality sleep, and how should physicians assess someone's sleep?
Very good question. Sleep now is being touted by my neuroscientist friends as the #1 risk factor from premature death from heart disease. The #1 risk factor is lack of sleep. Sleep is also the #1 risk factor for Alzheimer's. Ideally speaking, you should be sleeping 90 minutes of deep sleep and 90 minutes of dream per night. When we start our nights, initially, most of the sleep is deep sleep. As we get to the morning hours, it's mostly dreams. But it should be, out of 8 hours, 3 hours should be between dream and deep sleep. And there are all kinds of gadgets these days, I'm wearing them, where you can monitor your sleep, and you can reassure yourself that sleep correlates with everything from heart rate variability to inflammation to everything that we think is important for restoration of homeostasis. In Eastern wisdom traditions, sleep and awareness in sleep is also a window to higher consciousness, like soul consciousness, cosmic consciousness, divine consciousness, unity consciousness. So never compromise on your sleep, but also actually make sure that the sleep timing is right. The best timing for sleep is 10 to 6. If you stay up after 10, you'll disrupt your biological rhythms. You'll get inflammation in the body no matter what, because of the way our circadian rhythms function. So if you make that a rule, 10 to 6, and 3 hours is deep sleep and dream sleep, and you start to wind down around, say, 8 o'clock, not using too much, not watching TV or watching, being on the internet all the time. Your room is totally dark and without sound, and your temperature in the room is 68 and not too high, because you need that kind of temperature to go to good sleep. And if you just sit in bed and watch your breath or meditate, if you had a good, fulfilling day, you'll fall asleep automatically. And, sleep is the most rejuvenating. We say, I slept so well, I slept like a baby, because you go as close to pure consciousness in sleep as is humanly possible while we are living, other than samadhi. This is already probably the best way to go close to samadhi or transcendence.
Yeah, it's great that people are now focusing on sleep. I feel like people focus on exercise and diet, but in the past, people weren't focusing on sleep. And I feel like sleep is just as important, if not more important. So like you said, I'm glad that it's really been focused on.
Yes, sir.
Let's talk a little bit about mental health, and because you can't really separate the mind from the body. Mental health leads to physical health. How should physicians evaluate emotional health, and how do you maintain someone's emotional health organically?
Well, I worked with the Gallup organization, and they ask simple questions which are very reliable. So on a scale of 1 to 10, how would you rate your emotional health? If you have empathy, compassion, joy, equanimity, on a scale of 1 to 10, if you score 10, 11, 12, then you're thriving. If you say 6 or 7, you're struggling in some area. And if you score less than 5, you're suffering, you probably have a chronic illness. There's no need to distinguish between mental and physical, because they're the same thing. You know, every event in the mind has a biological correlate, a neural correlate, and a biological correlate. Everything that happens in the body has a mental correlate. So body-mind is one unit in the same way as space-time is one unit, or mass energy is one unit. And I wouldn't even make a distinction between the two. But having said that, as I mentioned, we have a site called neveralone.love that actually focuses on people's mental well-being and helps them engage with other people and focus on the 4 A's: attention, affection, appreciation, and acceptance, which is what human needs to feel emotionally fulfilled. So we facilitate that at neveralone.love.
I mean, that's a great initiative. Wonderfully said. Sticking on mental health, you know, psychiatric meds are given out like candy now, especially to the pediatric population. Do you feel like we're over medicating patients when it comes to mental health? Is that something we should change, can change? How should we change it?
We are over medicating. Having said that, there are indications when acute psychosis occurs for these medications. So, you know, we shouldn't throw the baby out with the bathwater. We should use antidepressants selectively. But do remember that, you know, most of your serotonin is coming from your gut. If you have a healthy microbiome, that's the first thing to start. And we go from there. And doctors, psychiatrists now are realizing that after 6 months or so, there's something called tachyphylaxis. People get used to, or they don't respond to antipsychotics as they would initially. So we need to be very careful right now in how we prescribe antidepressants and anxiolytics as well.
Yeah, someone here just mentioned about supplements. I do want to ask you about supplements because you know, supplements have been shown to be beneficial, yet there's so many out there. In your opinion, what supplements should be prescribed by doctors to their patients routinely?
I've been very interested in this topic for a long time and realized that as people grow older, they stop absorbing micronutrients because of the thickening of their gut. So I recommend, just to be on the safe side, that every adult should take one multivitamin with minerals every day. In addition, I recommend vitamin D, which has many other protective factors, including, you know, prevention from various kinds of reproductive cancers and many others. So vitamin D also, you know, it's been used for prevent osteoporosis, especially amongst dark-skinned people in temperate climates. But I recommend vitamin D for everyone. And then there are Ayurvedic adaptogens like ashwagandha, shatavari, triphala, that modulate the effects of stress at the cellular level. We've published a lot of data on this. It's available in the National Library of Medicine. But in general, I think we should not be overdosing on supplements. I know people who take 50, 60 supplements, and they're actually hurting themselves.
That's great to hear, you know, in terms of just honing down to what really matters and not taking every single supplement out there. I'm going to talk a little bit about cancer care, which is one of the pillars of academic healthcare. And, you know, the big question is really, how does integrative medicine, how does it combine with more traditional cancer therapies like chemotherapy and radiation? Obviously, it needs to be a more comprehensive, holistic approach. How do you envision integrative medicine working at major academic cancer centers?
See, right now, when I go to academic centers, I find that every academic center, when it comes to cancer treatment, has something called a tumor board. I'm sure you do that in your hospital as well.
Correct.
And the tumor board is very good because you have chemotherapists, radiation specialists, surgeons, physicians, all coming together and making the best choices for the patient. Right now, I don't see integrative or holistic doctors involved in the tumor board, nor do I see people who actually make a very big difference when people are going through chemotherapy or radiation. And because physicians don't actually have the time to talk to patients about hair loss. In passing, they will. Hair loss, nausea, vomiting, or other side effects. And patients are very concerned about that. And they're also concerned about mortality. But right now, nobody is giving them anything other than statistics. And, as you know, statistics can be very misleading because they don't pertain to the individual patient. If I know the average income of somebody in New York, it doesn't tell me what your income is, even though you live in New York. Or if I know the average temperature in wherever, in Montreal for the year, it doesn't tell me what the temperature is today. So we should be very careful that statistics do not apply to individual. They give us an average kind of count, which can actually have the nocebo effect instead of the placebo effect. So what I'm realizing is there's a big need right now for integrative medicine to be included. I have created an AI version of myself called Digital Deepak. And what I want to do is get this guy to be advising people emotionally and spiritually and on side effects while they're going through chemotherapy or radiation, etc., and work in partnership with oncologists, radiotherapists, and surgeons. That's an ambition I have, to help patients with cancer, because while chemotherapy and radiation surgery can be very effective in selective cases, they're also frequently overprescribed, as you know. If I go to a baker, he's going to sell me bread. If I go to a chemotherapist, he's going to sell me chemotherapy or radiation, whatever. So the tumor board is a very good innovation in hospitals, because you get everybody's opinion and the patient comes first and not, the specialist. But the tumor board is not enough. We need to include all these other strategies as well.
What a great idea. So you're saying that the tumor board should include an integrative medicine specialist.
Yes, at the very least.
Yep. And then patients undergoing cancer therapy should not only see a medical oncologist, radiation oncologist, surgeon, what have you, but they should weekly or every other week see an integrative medicine specialist who talks about stress and toxins and sleep and longevity and all the stuff that we've covered during this talk.
Correct, Ricardo.
That would be wonderful. I don't know how we do it, but we should definitely push that forward. I think it's an amazing idea, for sure. So someone else asked here about CBD and medical marijuana. That's obviously coming more and more to light. It's coming more and more into the mainstream. In your opinion, for what conditions are CBD and medical marijuana useful? And should these be prescribed, more easily by doctors?
I've been following the whole literature and the trends around CBD and marijuana, medical marijuana, and also psychedelics. So I see a role for all of them in selective cases. CBD and marijuana will decrease inflammation. In some cases will help sleep, but have to be careful that the dose is titrated. It's not so you get a high or whatever. It's not for entertainment purposes. But I see a role for marijuana and cannabis in general and CBD. And then recently I've become very involved in all the research on psychedelics. And it turns out that in selective cases, psychedelics help with inflammatory disorders, with depression, in anxiety, and also in sometimes what we call terminal care. So recently I've been engaging with psychotherapists in hospices and also places where there is deep interest in making people comfortable with death. And there's something that many doctors are aware of and many are not. If you worked in a hospice situation or even in a chronic illness ward, some people will share with you, and my neuroscientist friends confirm this. There's something called terminal lucidity that happens in a few patients. So the patient may have, say, Alzheimer's, or they have a stroke, and sometimes they might even be on a machine, but before death, 5 minutes before or a few seconds before, sometimes days before, they have terminal lucidity. Their brain waves show gamma frequency, which is very highly unusual. And they even supposedly speak to dead relatives and pets. Now, there's a whole nother explanation for that. But I have recently taken one of my my agents who was with me for 40 years. She had breast cancer and she was basically terminal, sat with her with the help of a psychotherapist who was also actually an academic researcher at NYU. And we took her through this experience. And I can say she was totally peaceful. So as we look at the future, I think we should be open to all the research that's coming out around psychedelics and medical marijuana and cannabis and anything that helps decrease inflammation, anxiety, chronic illness, and fear of death.
You know, speaking about technology, speaking about pushing the boundaries, you know, technology has brought into play stem cells and growth factors. In your opinion, for what conditions should these technologies be used, if at all?
Well, definitely stem cells are going to be the future, and embryonic stem cells can be harvested in the future even for organ replacement. But that's not there yet. Stem cells are not there. Growth factors can be very useful, selective cases, but we are not there in recommending growth factors to everyone. I work with stem cell researchers, and I do feel that this is going to be part of the future as we look at multiple ways to help patients. I think the future, Ricardo, for medicine is going to be personalized, predictive, preventable, participatory, process-oriented. And we have the technology. Also, there's a whole new revolution called digital therapeutics, where you can give ultrasound and other low-grade frequencies to the brain instead of pharmaceuticals. You can actually stimulate endogenous release of neuropeptides, whether it's serotonin or dopamine or oxytocin or opiates. Digital therapeutics is coming, so stay tuned for that.
So, you know, along those lines, you kind of jumped into my last question. You know, give us your crystal ball as to what the next 5, 10, 20 years of medicine look like. What are some of the major breakthroughs you predict?
I think the major breakthroughs are going to come in biotechnology, digital therapeutics, or what is called electroceuticals, ways to stimulate vagal tone, and ultimately a total integration so that we don't think of medicine as purely something that is a physical intervention. You know, we have to address body, we have to address emotions, intellect, it has to be rational and make sense, but anything that works. And these days, it's possible to get evidence and see if something works or not. So once again, I go back to my 5 Ps. Personalized, no treatment works the same way for everyone. So we can get we'll be able to do a health profile and personalized medicine. Predictable, because only 5% or less of disease-related gene mutation are penetrant. Preventable, participatory, your participation is necessary, and it will be a process. So once we go that route, I think the future of well-being is very bright, and ultimately it should also include spiritual healing and comfort with our mortality, knowing that there's a part of ourselves that is timeless and beyond what we call birth and death. That will be the future.
Deepak, I'm going to wrap it up because I know how incredibly busy you are. All I can say is amazing interview. Truly shows the importance of integrative medicine in the academic community. You are clearly a role model, a pioneer in this field. Really show us how to think outside the box and what that means. Look forward to more collaborations with you, melding between Eastern and Western medicine, bridging that gap. So again, thank you for your time. Happy holidays, my friend.
Happy holidays, and remember, holidays comes from holy days. So these are holy, sacred days for us to celebrate life. God bless.
Wonderful.
Thank you, Ricardo.
Thanks again, my friend.
Thank you.
Take care.
Bye-bye.